Well, the month of April is Autism Awareness Month, and a recent report came out saying that there's been a rise in autism over the years. Here to talk about this report is our parenting expert, Dr. Sheryl Ziegler. Good morning.
Good morning.
Okay, so I know that this has been such a topic on top of mind. When we're seeing more cases, how much of it is more prevalence versus more awareness of what's happening?
Yes, I was wondering too. The answer is we're not exactly sure, but the CDC essentially says, given the fact that we know to screen earlier and we know the signs and symptoms better, that it's probably, they think it's probably more just awareness and early diagnosis.
Got it. Okay, so for families who are looking at their child, what are they looking at before you realize, hey, do I need to go get my child screened?
So autism is a developmental delay. So what that means is when you have your baby, they're not going to look any different. They're going to be their beautiful baby. And then you may start to see that milestones are delayed, such as crawling, babbling, walking. So usually, I mean, there are some people who get diagnosed in infancy, but it's usually a toddler. Yes, usually about 18 months. So below 18 months is considered really early diagnosis, but sort of 18 months to 3 years is when you may start to see things like that lack of eye contact, the lack of the ability to speak. It's really heavy on speech. And so a lot of times their speech might start off as speech delayed. And then at that point, if a speech pathologist is working with your child, they may start to see the signs and symptoms, or the pediatrician, and then make a referral.
Is that earlier than before to be able to diagnose as young as 1.5 years? Has that changed?
It's getting younger and younger because we know those signs and symptoms. So yes, I think that, you know, there certainly are kids that get diagnosed at 5, 6, and 7 as well, but it is way more than norm. And especially here in Colorado, we have really good early intervention services. It's pretty common that in preschool, we also have more kids going to preschool. So now you've got a different set of eyes.
That's a good point,
You know, and so you are, you know, even if as a parent, maybe you don't totally see it, or the pediatrician, if they're going to preschool pretty early on, there may be someone there that says, okay, now I've got a whole classroom full of 2-year-olds, and your child, you know, may be delayed in these sort of motor or speech or social skills as compared to other kids. So it does provide that opportunity.
So your child's diagnosed, but there are options, right? There's therapy, there's help, there's support programs available?
Absolutely. The earlier that you can intervene, the better. It's usually a team. So unlike maybe some other diagnoses, this is really a team. It's usually maybe an occupational therapist, a developmental psychologist, and a speech and language pathologist that is treating the child, and pretty intensively early on. And absolutely, we see incredible gains that are being made. We also say it's a spectrum. So what that means is that there's some kids have mild symptoms, and then we've got, you know, really severe symptoms and being nonverbal. And so that can be confusing as well, because the spectrum actually is pretty large. But certainly early intervention is really key.
What would you say is first step? We're almost out of time, but I want to get to this. First step, if you do need your child screened, where do you go?
So if your child is under the age of 3 here in Colorado, you go to Child Find. And in Child Find, they will provide a free evaluation, which is really key. If they're over the age of 5, you usually go to your public school, and they can provide evaluations there. And free, again, so really keep that in mind.
Awesome. Well, thank you so much. I really appreciate you. This is so impactful and impacts so many families. So I appreciate your time.
Absolutely. Thank you.
Let's get